Good afternoon, everyone. Hello, and welcome to the Columbus Metropolitan Club, where we explore public policy issues, current events, and lessons in leadership at forums just like this one every week. I'm Deb Hackathorn. I'm the Government Relations Principal at Frost Brown Todd. I'm also proud to serve as the chair of the CMC Board of Trustees. Today's special program is the latest in CMC's long-running Optimal Health series. We're grateful to our series presenting sponsors, Ohio Health, the Ohio State University Wexner Medical Center, Nationwide Children's Hospital, and the sponsor of today's forum, Cardinal Health. The presenting sponsor of today's live stream is the Center for Human Kindness at the Columbus Foundation, and our live stream partner is the Columbus Dispatch. Finally, we wish to thank our host, the Ellis. Every CMC forum takes a village, often a very large village. Please thank everyone for supporting today's forum. Today's topic is Thriving Minds, Solving Ohio's Mental Health Crisis. Since 1949, May has been observed as Mental Health Awareness Month, making our program especially timely. Ohio's mental health care needs are as acute as they've ever been, but Ohioans' struggle with mental health has also achieved a new level of visibility, thanks to the persistent dedication of mental health advocates like our guests today. We're thrilled to welcome today's panelists. Erica Clark-Jones, CEO of the Alcohol, Drug, and Mental Health Board of Franklin County. Leanne Cornyn, Director of the Ohio Department of Mental Health and Addiction Services and a member of Governor DeWine's cabinet. Andrielle Umbume, CEO of Healing Without Limits Counseling and Consulting. And our host today is Charlita B. Tavares, the Chief Executive Officer of Primary One Health. Charlita, welcome back to CMC. The podium is yours.
Thank you very much, Deb, and I am excited to get started on today's panel. This is very personal for me, having had a younger brother, these are my words, who suffered from mental health disorders. And unfortunately, my younger brother completed suicide about 20 years into his disease. So these issues are top of my agenda, and I know they are of our panelists today. So I'm going to get us started with some of the questions to kind of set the tone for today's session. When we talk about mental health, what exactly do we mean? This is really a chance for you to define what we're talking about. And anyone can take the question.
I'll start. So I really actually love the World Health Organization's definition of mental health because I feel like it encapsulates all of it. Mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn and work well, and contribute to their community. I feel like it really encompasses all of the domains of recovery and wellness. So I think that definition is just really great, but I'll defer to my colleagues as well.
Absolutely. When you think about your mental health, really your mental health drives everything that you touch. And so when you think about mental health and you think about relationships, your workplace, how you show up, your mental health really drives that. And so it's a way to think about kind of your compass for life.
The only thing I would add, and I agree with my colleagues here on the panel, is that there is a difference between mental health and mental illness. And that's where, even just recently this week, the increased awareness about mental health and the needs that you have were highlighted in the New York Times. And this increased awareness of mental health is important, but in the event there is mental illness, acting on that, right? Seeking out professional counseling to get a diagnosis and then understand what your treatment options are, and then following a path of treatment that leads you to recovery so that you can have a fulfilled life is exactly what we want to make sure is available across Franklin County and I'm sure all of our communities.
This next question gets to what are the characteristics of someone who has good mental health versus someone who may have poor mental health? And I know it's on a continuum, so anyone, again, can answer this question.
So someone with good mental health would be someone who has the tools to navigate life stress in a healthy manner. They oftentimes will have healthy boundaries. Think of, healthy mental health is they find themselves in healthy places, whether those are relationships, whether those are workplaces. They prioritize healthiness and they take good care of themselves. So good mental health is simply, when you find yourself in these healthy places.
The only thing I'd add is that it's on a continuum, right? Just because you may have a mental illness or a diagnosis doesn't mean that you can't have positive mental health. With appropriate treatment and healthy lifestyles and the supportive community around you, you can thrive because recovery is possible. Just like somebody who may not yet have a diagnosis may not have positive mental health because they don't have those assets around them. So it is on a continuum.
I want to go to what are the common disorders, the mental health disorders, and then to talk a little bit about whether or not those disorders are more characteristic of certain age groups, certain populations, demographics.
So the most common mental illnesses in this order is anxiety, depression, and PTSD. Individuals are likely diagnosed with their first episode of mental illness between the ages of 18 to 24. However, individuals can be diagnosed with a mental illness across their lifespan. And the reasons for developing a mental illness can be genetics, it can be environment, it can be trauma. And so while we do see individuals diagnosed between the ages of 18 to 24, it can happen across the lifespan.
I am not a clinician, but I want to just pick up on a thread that Ariel put out here. Because of the information she just shared, it's really important that alcohol, drug, and mental health boards, of which Franklin County is one of 50 across our state, that we are supported by the Ohio Department of Mental Health and Addiction Services, as well as a local tax levy for property owners here in Franklin County. It is the reason why we have a full continuum of services. We really fund in 6 primary areas, and they include crisis, treatment, recovery, family supports, housing, and then prevention. And so we're talking about funding for school-age children all the way up through adulthood and status as a senior, because we do think it's really important to care for everyone's needs across the lifespan.
And that question in and of itself, in your responses, makes me pose another question. How are people accessing mental health services across the spectrum?
So the Ohio Department of Mental Health and Addiction Services, as Erica mentioned, is one of the primary funders of our ADAM-H boards across the state. And one of the ways we are trying to build out capacity, we know, we have so many friends in the room who operate hospital systems. We know that unfortunately too many Ohioans are accessing behavioral health care in emergency departments. And unfortunately, this is not the most appropriate setting for people to be able to access the kind of care that they need. One of Governor DeWine's top initiatives in his last state operating budget was to fund a crisis continuum in Ohio. So we have been able to invest in building out new services across Ohio, as well as new brick and mortar facilities, to make sure that there is something in everyone's community that hopefully is 24/7, that is supportive of behavioral health and crisis conditions, where they can go to receive help, or to have someone come directly to them. One of those services that we hope to be issuing an RFP on soon is mobile response and stabilization services. This is a specific service for young Ohioans up to the age of 21, where we can deploy someone within 60 minutes to come to their home, to the emergency department, to their school, wherever they're at in the community, to help de-escalate that situation. And we know we have incredible outcomes with those programs, so we are really excited to stand up those services. We're also partnering right now with the Department of Medicaid to ensure that there is a sustainable reimbursement program for that as well. We don't want to just build these services. We want to make sure that Ohioans can continue to access them.
Well, That's music to our ears in Franklin County. And I can't possibly let this moment go without talking about how we support that vision and the will of our stakeholders here in Central Ohio. So we, in alignment with the Ohio Department of Medicaid and Addiction Services, fully embrace a full crisis care continuum. And that's someone to call in the event you or someone you love is experiencing a crisis, someone to respond to that crisis, including our mobile crisis response teams for adolescents as well as adults, and then, of course, when necessary, somewhere to go. We're very fortunate to have the support of so many stakeholders, including government, private sector, and of course levy support, to be able to invest in a 70,000 square foot crisis care center that we are targeting to be open this time next year. If you drive out to 465 Harmon Avenue, or you're coming east on 70 West, and you look over, you will see this fantastic facility where we plan to have a 24/7, not just a behavioral health urgent care-like service, we'll also be able to have a 23-hour observation unit, and if folks need to stay longer than that time, have 16 inpatient beds. The goal, though, is to obviously meet people where they are when they need it most, but then when leaving the crisis care center, be connected to ongoing care. We also know we want to treat the whole person. So we're working with local partners, specifically Ohio State Wexner Medical Center, to make sure we're providing primary care light in that center as well, so people don't have to leave and go to the emergency department. I brought a couple facts that I just want to highlight, if you're okay with that.
Absolutely.
You know, Charlita was like my boss at City Council long time ago, so there's some deference here. So what I would say is, you know, I don't want to overlook the obvious in terms of access to care, and that's 988. You know, 2 years ago, we did not have 988 as a community to call 24 hours a day, 7 days a week when someone is indeed in crisis. We have that here, and we fully support it here in Franklin County. So at this time, just to give you a sense of the crisis activity happening in Franklin County, on average, and this does not include 911, we receive 250 calls per day. That does not include 911, where most people are currently calling to access crisis services. When you look at the mobile crisis response, we have several teams out in the field, including a partnership with Columbus Public Police and Columbus Public Health. We are responding to 69 episodes per day. So on 69 times any given day, there is a team deployed, and a team could be a clinician and a peer out to a community member in crisis. And then I just recently got some data, thanks to our Adam H. team, there are about 69 crisis episodes that happen in a center here in Franklin County. 73% of those episodes happen in our emergency departments, as Director Cornyn mentioned. And so we know we can do better, and we want to be able to treat people in the community where they are. But what it is highlighting access points and no wrong door for anyone who's in crisis.
I would like to add that we know that we have about 60 million visits to primary care providers for treatment for mental health disorders. And so we also know that people are going to their PCPs to receive treatment. The federal government and other governments, and I'm happy for you to add, has really focused on integrating behavioral health into primary care. And it's such a brilliant concept because we know people are going there as well to receive treatment. As well as I would be remiss if I didn't talk about telehealth and how it has blessed all of us to be able to see our patients from a screen and touch people that might have transportation barriers or that might be in a rural community and may have transportation, but it might be a lot for them to get to us. And so I'm very grateful for telehealth. When I started off as a therapist, there was no telehealth. You were in a room. And so I'm very, very grateful to see that innovation take place.
And I'm glad you mentioned both telehealth and the integration of behavioral health with primary care. as the CEO of Primary One Health, that's what we do. We have integrated behavioral health with our primary care services. But I want to talk about and ask this question about other promising advances, practices, and trends in crisis care, both recently and those that you believe are anticipated for the near future. And you spoke on this earlier, the Adam H. Crisis Center.
So the only thing I'll add, as Erica already referenced, is the existence of the statewide 988 system. So we, in July of 2020, were able to launch 988. We're coming up on its 2-year anniversary. So we are very excited about this. We serve 160,000 calls, texts, or chats on an annual basis. We're getting 12,000 in reaches every single month. So we know the need is out there, and only about 1/3 of Ohioans know that this number exists. We last week launched a statewide awareness campaign. So my ask of all of you in the room is make sure those that you work with, those that you love, know that this is a resource, because even though we had 988 in 2022, it was still our second highest suicide rate in Ohio history. So we know that not enough Ohioans know that this resource exists and that they can reach out for help when and where they need it.
What does the data tell us about the trends in mental health? Are there trends that are promising or troubling that we're seeing in mental health? We talked about the number of crisis calls that are coming in. We talked about some of the services that are being provided.
I would like to add that we know, unfortunately, that suicide is on the rise. We know that we are in a youth mental health crisis. We know about 50% of people that have mental illness do not receive treatment. And so I would call all of that very troubling. But I am grateful for the efforts through government and the private sector to address this.
I have to agree with Ariel. A suicide rate is very concerning, frankly. Here in Franklin County, I know we experience about 12 deaths per 100,000 residents, but that number is increasing and is increasing fairly rapidly over the last 2 years. And so I think 988 makes a difference in those strong community connections, treating the whole person and making sure folks know they're not alone. They have support in the community is really important. Just recently, we have had a team member reach out to the construction and building trades because they reached out to us and said, we have a challenge here with the men and women that work in this industry. We also know in Franklin County, we have higher suicide rates among males of more than one race. We have high suicide rates for older adults as well as teenagers. So those are areas in which we can work very specifically and intentionally with those populations in the places that they touch to help make an impact long term.
And that brings me to this next question. There have been studies linking poor mental health to social media use, especially among our young people. There's little regulation on the social media use by young people, especially compared to many regulations for them with tobacco and alcohol, even riding in a car with a seatbelt. From a regulatory or policy perspective, what should change in regards to the access to social media that young people have?
Well, some of this may be a repeat from last week's presentation when Governor DeWine was here. I'm confident he probably talked about social media use amongst young people. In our last state operating budget, there was a provision included that would have required parental consent for any minor under the age of 16 to create a social media account. Unfortunately, that is being held up in the courts. The governor, during his State of the State speech, gave a great commission to the General Assembly to take a look at the federal holding and let's retool, let's readapt to make sure that parents are the ones driving social media usage for their young people. We do know that social media can have a positive impact and can create community that individuals may not be able to otherwise access. So we appreciate its importance in that regard. But we also, the governor, I'm sure, talked about some of the impacts that we're seeing academically, socially, from a sleep standpoint. So we anticipate and hope that the governor will be able to sign a piece of legislation relatively soon that would limit access to cell phones during the school day, which we think will be a positive step to ensuring that young people people can focus not only on their academics, but also mitigate some of the social media challenges and behavioral health challenges that they're experiencing in schools.
The next question is going to employers and their impact. Many employers seem much more willing today to respond positively to mental health needs of their employees than in the past. Why has this changed, and why should employers even care?
Well, we all experience a pandemic, and what that has done is brought mental health to the forefront. When you say the pandemic, people might have certain thoughts, they might have certain emotions that's invoked by that word, but we all know from a global standpoint what that means. It has also shown that when you go into the workplace, you have to be well to be successful. And so organizations are acknowledging that. They're acknowledging that in order for someone to be successful, you have to give them the tools to. And furthermore, when you don't, it has implications on your overall organization. And so we're seeing those conversations be brought to the forefront, and we know the time is now.
I would just like to add that this culture of belonging that a lot of organizations are embracing is really good, and I think it's very healthy. Last year, the United States Surgeon General released a report about loneliness, and I think Dr. Acton was here at the CMC recently over the last month or so, and talking about the impact of chronic loneliness. This was also featured last week in the national media. If an individual that is experiencing chronic loneliness has an increased rate of premature death, I think it exacerbates it by 26%. If you add social isolation, which a lot of us experienced in the pandemic, you can increase that by an additional 29%. So being really intentional about creating spaces where people can come together physically, partner, do things socially that kind of reiterate the support, not just in the workplace, but even outside of the workplace, is really something we'd like to see. And I think the Surgeon General even mentions it's something that's encouraged. I also think, quite frankly, communities can take the hint. Start doing more of what we were doing pre-pandemic and organizing activities and spaces, healthy spaces, for people to congregate, get to know one another, build strong relationships, and support one another.
I will simply add that I think awareness has increased pretty significantly since the pandemic about the impact of mental health on our workforce and our kids. I know Nationwide Children's Foundation on our sleeves has done a ton of research about the impact on our workforce due to children's mental health and the number of days that parents miss and the financial impact that that has. We know that the depression is the leading cause of disability around the world, and according to the Ohio Suicide Prevention Foundation, every 3 months an individual suffering from depression will miss about 5 work days and over 11 productivity hours. So collectively across the globe, this is impacting businesses to the tune of about $1 trillion a year. So in addition to awareness and reduced stigma through the Beat the Stigma campaign that we launched in partnership with the Nationwide Foundation, we think there's awareness, but there's also a greater recognition of the financial impact of not acting on this and creating those supportive spaces and programs for employees.
And for the employers, are there some leading practices that employers are taking on themselves, or is there something that's growing in the community with employers to help their employees deal with their mental health challenges?
Absolutely. One thing I will add before I talk about what we're seeing leader employers do is that the Surgeon General released a framework about mental health in the workplace. And so it's incredible to see federal efforts as well as local efforts talk about what we need to do in our communities to be successful. And I'll also add, when we think about addressing a mental health crisis in our community, it's truly about infusing mental wellness into all aspects of our community, which is what we've talked about today. day. And when we talk about the workplace, we are seeing employers acknowledge that there's no cookie cutter solution. There's no one training you're going to do that's going to solve all your workplace dynamics. So organizations are working with workplace consultants to be able to go in, assess the dynamics, and then create a strategy based off of the findings. No two organizations are the same, and so it's very important that you understand where your organization is, and then what do you need to get to your goals.
I'll simply add employee assistance programs, they're a great first step. Looking at your policies and procedures are a great next step. Looking at leave policies. One thing I'll add that we have recently launched statewide is free access to mental health first aid training. We've seen a lot of employers, especially to Erica's earlier point, especially in high-risk communities like the construction industry, sending their staff, sending their HR teams to get trained in mental health first aid so we can recognize the signs and symptoms of somebody who might be struggling with mental illness. So it's a great opportunity for those of you who are looking to create more understanding and awareness in your business to get that additional training free of charge.
If you don't mind.
Go right ahead.
I want to I'm just going to deviate just a little bit to say, with all of this increased awareness and employers trying to galvanize additional support for workers, that means we need a strong behavioral health workforce. And the behavioral health industry is no different from several of your industries here. And AdamH has partnered with several local providers in Franklin County to develop a workforce development plan that focuses on recruiting young members or folks that have the correct licensure to serve in the community-based behavioral health system. We need more clinicians. And we've also, thanks to the help of the governor, partnered with our local institutions to be able to develop this talent pipeline that can work across different organizations.
Thank you for sharing that, Erica. It seems like our Ohio residents and Americans in general are talking more openly about mental health and even their mental health challenges than in the past. And first of all, do you agree with this? And if so, why do you think this has come about?
Again, I'll just reiterate my earlier point regarding stigma. We know that there's greater conversation around the prevalence of mental illness. The pandemic was a great sort of inflection point for us to realize that all of us know somebody or have been personally impacted by it. So I think there's a greater understanding and awareness. We are beginning to see some reports of over sort of medicalization of terminology and young people using phrases that they don't fully understand and then self-diagnosing, and then that kind of compounds. So we just need to make sure that as we continue this conversation about mental illness, we're also giving young people the tools they need to cope and self-regulate. So I will underscore the importance of prevention in our schools, because just using the lingo and talking about it isn't enough. We really need to understand and support one another and build that pipeline of workforce that can help, address individuals early on and over the course of their recovery and lifespan.
Absolutely. Oh. You sure?
I just want to pick up on a point that Director Cornyn mentioned about this Beat the Stigma campaign. Franklin County AdamH was thrilled to be a partner in the Beat the Stigma campaign, which originally focused on overdose and opioid use and really getting that conversation out into the public so people could address it. We love the fact that more people are accessing care and making the call and getting over this, the stigma that we saw pre-pandemic. We have partners like Nationwide Children's Hospital that is on our team, essentially one of our providers that is working in schools to address the issue that you talked about. And again, that is something that people are talking about nationally. It's all over TikTok. If you're on TikTok, I am not on TikTok. I follow the governor, right? The governor says don't get on TikTok. I'm not on TikTok. However, I know it's being talked about there, and that's why we think having school-based clinicians on site are really, really important.
Absolutely. And I would just add, if any of you spend any of your time on social media, TikTok, the latest thing is that everyone is a narcissist. And that's problematic for a few reasons. I must bring it up. Because narcissistic personality disorder is a real mental illness, just like depression, anxiety, so on and so forth. And when unlicensed people diagnose people via social media as a narcissist, it perpetuates stigma. Just because you don't get along with someone or they have unfavorable actions, it does not make them a narcissist. And what it does do for the people who actually suffer from that mental illness, it makes a mockery out of it. And it makes you, not have the courage to speak up and say, I need help. And so that impacts their recovery. And so we know that stigma is really important to fight, to overcome the crisis we in, but we have to be careful about our behaviors and then how we take those into different aspects of our community.
Thank you all. I have one last question of you before we go to our audience. What are the most common misconceptions about mental health?
Sure. Oftentimes people think it can't happen to me. And that is an idea that oftentimes keep people safe, if you will, because if it can't happen to me, it's over there. And if it's over there, I don't have to acknowledge it, right? And that can be problematic because as I mentioned earlier, mental illness can happen to anyone across their lifespan. Also, this idea that they're lazy or, again, problematic, things of this nature are a lot of misconceptions about people with mental illness. And also, my colleagues noted earlier, that they can't recover or that a person has mental illness, can't be a productive member of society, they can't be successful, and those are true misconceptions. People can recover, they do recover, and they are successful in life and still have good mental health, if you will.
Thank you.
I just
Go
wanted
ahead.
to add this. I love everything that you put out there. And when you are when individuals want treatment, we want to make sure there are no barriers to that access to treatment. And so in Franklin County, the ADAMH board, we make sure that anyone, regardless of insurance status, can access care. Regardless of income, regardless of insurance status, any network provider you will be seeing, and that's where ADAMH takes care of the individual.
Thank you all. We're going to take some questions. It's CMC's longstanding tradition to take audience questions. We'll move to questions from our live stream and in-person audiences. And if you have a question, please make your way back to the microphone, back by Doug in the back. If you're watching online, please type your questions into the chat. Before we take audience questions, panelists, I want to have Doug give the first online question.
Charlita, thank you very much, and thank you to today's panelists for a great conversation. We're getting a lot of questions from our online audience. They were not shy. And for those of you who are in the room, please do join me here at the microphone, and we'll try to get to as many questions as we can. Please do keep in mind, great questions at CMC have two things in common. They take less than 30 seconds to ask, and they end in a question mark. So we'll start with this one. It's from Dr. Saleshi with Ethiopian Tewahedo Social Services. Many of you probably know him. This is a great question. How do the panelists support culturally and linguistically appropriate mental health and counseling services?
Well, I thank you for that question, and I think it's a great question because in Franklin County, we have a very diverse population, and we take care to make sure the providers in our network have agreed to and have the ability to serve individuals from various backgrounds. In our annual service contract that sees anyone, regardless of ability to pay and insurance status, it also is regardless of race and ethnicity. We support translation services. We do our best to attract and retain providers that have different ethnic background to make sure we are meeting individuals with those most acute needs where they are. So we are very mindful and seek out providers that have a culturally responsive practice.
I'll add that at the Department of Mental Health and Addiction Services, we have a dedicated team that's focused on cultural and linguistic competency, both within all of our internal practices, policies, helping to put that lens on the work that we do. Just like Erica, we do a significant amount of translation services for our materials to ensure that they're responsive to some of the most common foreign languages spoken in the state of Ohio. Our CLC team also provides grants to targeted populations and organizations across the state. And we recently, in partnership with the Ohio Suicide Prevention Foundation, we saw in our suicide data that Black adolescents were at one of the highest risk groups for completing suicide. So we recently funded a pilot program in partnership with them to create some statewide learning and community building education within the Black community, leveraging some non-traditional partners. So those are just a few ways the department is supporting this work as well.
Talk specifically about staffing,
Sure. Anything particular?
just the needs.
Absolutely. Well, maybe I'll just add what we just talked about some of the work that's coming down from the federal government. We know that when we talk about quality treatment, cultural competence is key. And so the federal government has actually released some funding recently to help create programs for minorities to go into the field of therapy, social work, so on and so forth, because we know that our education to get into mental health is rigorous. And you have to work unpaid at times, and there's work being done to make that paid at different levels, but they're providing funding so that people can not have a barrier to even get into this field.
Thank you. I think we have a question from the audience.
Hi, good afternoon. My name is Stephanie Matthews. This question is for Andrielle. Andrielle, how can businesses integrate holistic wellness practices into their corporate culture to enhance employee well-being, productivity, and overall job satisfaction?
Absolutely. Well, to piggyback on kind of some of what I've shared earlier, it's really about understanding your workplace dynamics and acknowledging that, again, in order for your people to thrive, you have to give them the tools to do so. And so some of the work that we do at Healing Without Limits is we help corporations infuse mental wellness into their company culture for success. And we do that work by doing organizational assessments to understand the lay of the land and then helping them build strategies to address whatever they're presenting issues. And so whether you work with us or someone similar, really understanding what is your organizational health and then creating a plan informed by those results.
And I think we have an online question next.
Charlita, thank you. Carol Looper asks, is there anything being done to increase training specifically for youth-focused mental health professionals?
So the department is currently investing $85 million into what we are calling, remind me the name? Great Minds Fellowship. Thank you. Sorry. So we are working on building out career pathways for all behavioral health professionals across the state of Ohio. We are offering individuals in their second to last or last year of a social work, therapist, counselor, forensic nursing, or other behavioral health related career pathways and degrees with a $10,000 scholarship, as well as $5,000 in recruitment and retention bonuses if they enter the community-based field and stay there for at least 1 year. So it's not specific just for the pediatric field, but it is to build out the entire continuum of that workforce. One component part of that, I'll just add, is 11 million of that 85 million was dedicated to building up additional programs across the state, and one of those programs is a partnership with Wright State University, where we're actually going into high schools in the greater Dayton area and trying to engage young people so that they see themselves in the behavioral health field. So we're really excited about that work to try to build that excitement and passion, and hopefully we see the outcomes of that with greater representation in the behavioral health field.
The only thing I would add is it is exactly that Great Minds Fellowship that Franklin County is taking advantage of to partner with our institutions of higher learning, including Columbus State and Jobs Ohio, to really make something happen, to identify those pathways for students here in the Columbus area to get into the field across all of those licensures that she mentioned.
And then I also want to share that the federal government, the Health Resources and Services Administration with the U.S. Department of Health and Human Services has funding loan repayment programs for individuals who go into social work, behavioral health, because we really need more clinicians. We talked about integrated health, more clinicians in the substance use disorder and mental health fields. We have another audience question.
Hello, my name is Lillian Corbiny Morgan. I am the co-chair of the Black Girl Rising think tank. Part of our focus is the mental health and rising suicide rates in Black girls, so it was really interesting to hear you all speak, and I was really grateful. My question, though, is more so focused on what you think the generational divide is, because I know myself, along with my peers, feel that there is an instinctive cultural difference when talking about mental health issues. And I was wondering what was being done to focus on the family, because if you have parents that are raised in traumatic situations or are dealing with mental health issues that are then raising children who dismiss or are going through their own processes of trauma based off of what their parents have been taught and how it bleeds through, you create people who are incredibly anxious or depressed or aren't sure how to process it. And I know that with my generation, and we're all about to go to college, but we started in the pandemic, so we're all very, I feel, unsure of where we're at, but we're also hyper aware because of social media and because of the news and everything that's going on. I was wondering, how are you able to not only look at like everyone as individuals, as like an older youth or a man or a teenager, but like as a unit as a whole?
So I'll jump in and simply say that you are absolutely right. In our 2022 Ohio Suicide Report, we saw a 56% increase in suicides among Black females. So we know that they are one of our highest risk groups, and that is a emerging trend. So there's more that we need to do in that space. One of the things Governor DeWine is very passionate about is prevention. And we know that prevention can occur across the lifespan. It's not just in, our K-12 system. We have to start earlier though, right? We know that a child can start absorbing trauma as soon as they're born, even prenatally. So one of the things the governor has heavily invested in during his administration is evidence-based home visiting. We think that this is an incredible two-generational opportunity to not only help that child achieve their developmental milestones, but also provide that education, awareness about trauma and its generational impact, and training and education for parents. We are excited that we have doubled the number of families who have been served through that intervention and service since we've come into office. There's more we need to do, and there's been dramatically increased investment in the governor's operating budget to support that work. So we think that is an amazing start to, like you said, the generational implications of trauma.
If I may add, I think the key is understanding those communities, and it goes back to culturally competent care. So when we talk about Black women, oftentimes in the mental health space, we talk about the strong Black woman narrative and what that does for a woman of color's mental health. When we talk about older adults, we need to talk about the things historically that has happened that has caused them to approach mental health in the ways that they do. And so it's really important that we understand these specific populations and we have specialized care that can address their unique needs.
to that point, when you ask about data and what groups that we're looking at the Adam H. Board of Franklin County, we do disaggregate our data by ethnicity and race. And so we do look at trends over the years about where we are seeing increases or decreases, and then target our investment to that group, in particular, Black Girl Rising. And it looks like I'm really thrilled that they have sent an ambassador like you, quite frankly, to ask this question. And personally, I think you should get in this pipeline, right, to be a service provider at some point. I love the way that you position the question and, quite frankly, put out there what your generation is thinking about and going through in a very real way. So thank you.
And I think we have another online question. Doug?
Thank you. And I'll just point out that Lillian has been a CMC panelist before, so welcome back, Lillian. Christopher Rooks with Columbus Fury asks, what positive advertising campaigns to promote mental health awareness, and especially those geared toward millennials and Generation Z, should we be looking out for?
So I've talked about this a lot today, but our Beat the Stigma campaign far surpassed any of our expectations, and I think that's incredibly attributable to the number of community partners we had investing and advising on that. We really tried to be responsive to individuals with lived experience, the business community, everybody. We had an over 90% recall rate for individuals who saw that commercial, which is, I think, effectively unheard of in the marketing space. My background is in education, not marketing, but one of the things, again, we just launched last week that is, there was a ton of market research put into, is our 988 media awareness campaign. And very soon we will have a generator available online where any organization can go in. We have different silhouettes available that look like different communities across Ohio where folks can generate their own 988 media collateral. You can add your logo to it. It's a really great opportunity to customize those 988 awareness and educational pieces to fit the needs of every community, regardless of what generation, regardless of what demographics. So really encourage folks to visit our website, mha.ohio.gov, for more information on that. We hope to have that up soon.
We have another question from the audience.
Hello, and thank you all. Dr. Shantae Meadows. I am the owner of Meadows Counseling Group, as well as the board president of the National Association of Social Work here in Ohio chapter. And I add that with also being a community lecturer in the College of Social Work. And my question kind of comes from the private sector. I think one of the issues as being a mental health clinician for almost 20 years is we have seen with post-COVID people who are insured, so they don't necessarily have a CareSource or a Medicaid-based program, they have a private base. And so what we've seen post-COVID is increase in deductibles, and so access is increasing. And so my question comes from the support in the options as a private practice clinician, as well as someone who, I develop a lot of the new upcoming clinicians. What support or options is there, even from the state perspective, Adam H. perspective, to help support the private sector, those who are in the private practice, the group private practice? Like I said, as I have 10 Black and brown clinicians, I take on students, and so we're in this place to develop, but I often feel like this is a sector that gets missed as how to help in this access issue. So I am curious, is there any initiatives or perspectives or advice even on how we connect to that sector?
So maybe not fully responsive to your question, but the governor was, when he was in the United States Senate, a co-sponsor in the Mental Health Parity Act of 2005. Parity is something he's very passionate about. Director Judy French with the Ohio Department of Insurance is leading a lot of that parity work. What we helped stand up the Ohio Mental Health Insurance Assistance Office. So this may be something that you guys want to make your employees aware of. Anyone, regardless of payer source, can call and try to understand what their mental health insurance options are with their plan. Any plan, doesn't matter. It's completely free. The number is 1-855-438-6442. So we do think that that's an incredible resource. Not, again, totally responsive, but we also have made historic investments into behavioral health reimbursement rates over the DeWine administration that we're incredibly proud of. That's for Medicaid enrollees only, but we think that that will go a long way to making sure that we have more folks in the field writ large who can do this work.
No, I think those are all great points, and I was going to lean to the policy side, because I think that's where we need some action to be able to establish parity for private providers. At MH, we contract largely with nonprofit providers, and so I would encourage collaboratives, innovative collaboratives, where there is a partnership between that private provider and one of our local nonprofit providers, such as Mary Haven, NetCare, and other significant behavioral health care providers across our community. Thanks for the question.
I would also encourage with our federally qualified health centers, because we are one of the providers for Adam H., but also you can get the whole health addressed at one location. And so FQHCs, community health centers, can partner with the private sector, particularly when we're looking for clinicians of color. I was blown away when you shared the number of Black and brown clinicians that you have, because that is the hard clinician to find in Central Ohio, and I would believe across the state. So I would think that these organizations would contract with your organization to provide the services that best met the needs of our patients.
Just one more thing to add. The department, in partnership with the Ohio Department of Medicaid, is exploring creating an Ohio model of the SAMHSA certified community behavioral health clinic certification. So that is potentially another opportunity where we're looking to fully integrate physical healthcare with behavioral healthcare, meaning SUD and mental health. We anticipate standing that program up by January of 2026, but there are opportunities, to Charlita's point, about subcontracting with other providers to deliver some of those services. There's more work happening on this, so it sounds like maybe we need to get you plugged into some of those work groups.
And if I can just briefly add, certainly second that there is a policy component to addressing the systemic challenges in the private sector, but additionally, Healing Without Limits was fortunate enough to do a multi-year project with the United States HHS to help the federal government advance the behavioral health system at the federal level and reduce overdose deaths. And with that, we've seen firsthand that Biden's administration is putting a lot of funding into private and public sector organizations. So if you are a private practice and you're looking for a grant to be able to provide your services to people, potentially free of charge, if that's how you choose to do your model, that is opportunities that are coming down from the federal level. So I encourage private practices to keep an eye out from SAMHSA and the work they're doing in that space.
Doug, we have another online question.
No, we're going to do two more in-person questions. We have about 3 minutes left, so we'll try to get both these questions in.
I'm Shiloh Todorov with Families Flourish, and Erica, I have a question for you. I heard you call out housing as a piece of what Adam H. focuses on, and I want to ask about kind of the goals and inputs that you're working on as an organization like yours. Just mentioning that Families Flourish does coaching programs and partial rent support. We're evaluated by OSU, and we just got our most recent data that showed these huge mental health gains in just the first 6 to 9 months of being stably housed in a safe, healthy home. And so I'm curious, how does Adam H., what are the lenses of the goals you have?
No, thank you for the question. And I admire the work that Families Flourish does. So 3% of the Adam H. budget goes towards housing. Now, our efforts and our investment really focuses on units that support people living with serious mental illness that cannot live on their own. That is the level of housing we want to make sure is available in our community, and we don't have enough units. And so, quite frankly, if I had to focus our investment it is in that space. This also comes into play when there are individuals in the state hospital that need to be reintegrated into the community but cannot yet live on their own, even if it's for a short time. We want to make sure there are multiple units available across the county, not concentrated in one area, so that individuals can reintegrate safely into the community. And it can be relied on as a recovery support. Because it is one of our, hierarchy of needs, it has to be accommodated for an individual to get well and stay well. And that's why we put investments in that housing. So we hope to be a part of the broader conversation in Franklin County about increasing the number of units. I know there's been several CMCs about the need for 54,000 housing units across Central Ohio. We would say that a portion of that should absolutely go to those individuals that are living with mental illness as well.
Thank you, Erica. We have one last question.
Hi, Brian John, Echo and Athena. I'm a cognitive well-being coach. And my question is, with the current state of our state in regards to the stressors that women are facing regarding reproductive rights, as well as the continued policies and laws that are put in place that ostracize and create undue mental distress on our LGBTQ plus communities and families, what is being done at the governor level, at the governor's level, and at the local level to truly support people who are going through severe mental distress as a result of policies and laws that target their communities and rights?
Panelists, if you could make your answers short.
Start at the local level. Franklin County ADAMH partners with many community providers, actually over 35 community-based providers here, and we have a specific relationship with agencies that serve the LGBTQ plus community. We consider that to be, quite frankly, where we should stand and help make sure services are available 24/7.
Governor DeWine has invested in a whole array of services and supports to ensure that all moms, regardless of their socioeconomic status or demographics, have access to more expanded childcare, evidence-based home visiting, high-quality workforce development programming. You name it, we've really tried to invest in it. I will also add that 988 has a specialty line. Any individual in the LGBTQ community can call 988, and there's a specialty hotline that can serve them should they be in crisis.
And I want to thank all of the panelists for your responses, but it's time to wrap up. And so I'm getting the wrap up and the signal from Doug, and I'm going to turn it over to Deb Hackathorn for concluding remarks. Thank you.
Well, I hope you'd agree there was a wealth of information shared with us here today. So please take advantage of all of the resources and recommendations that our panelists have made about ways you can get more involved or seek help yourself. I want to thank the presenting sponsors of the Optimal Health Series for CMC, Ohio Health, the Ohio State University Wexner Medical Center, Nationwide Children's Hospital, and thank today's sponsor, Cardinal Health. And thank you to the presenting sponsor of our live stream, the Center for Human Kindness at the Columbus Foundation, and our live stream partner, the Columbus Dispatch. Thanks to our host, the Ellis, and a very special appreciation to our speakers today, Erica Clark-Jones, Leanne Cornyn, Andrielle Umbume, and our host, Charlita Tavares. Thank you, all of you. Please do make plans to attend next Wednesday's forum, Hiring Heroes, Why Ohio's Workforce Needs Veterans, featuring a panel of passionate leaders you'll want to hear from. So thank you again to everyone for being here. Have a wonderful week.